Everyone has been talking about ChatGPT for months. It has passed law, business and medical exams. It qualified as a level 3 coding engineer at Google. It outperformed students in microbiology, and the list goes on forever. It even reached 100 million users in 2 months. It took TikTok 9 months to reach the same level of users. It's extraordinary. Plus, it's a breakthrough moment. For years, I've been talking about the importance of AI becoming the best assistants we could have ever dreamed about, especially when it comes to medicine and healthcare. Now it's here. You can use it every day to learn to work with it, to learn to write better briefs and prompts, in general, to learn to work with AI. Even I have become a pro user and I use ChatGPT daily. I cannot tell you how much time it saves me every single day, and also how better I have become in the last couple of months, writing briefs many times every single day. So I thought, let's just summarize what we can expect from this breakthrough technology when it comes to healthcare. Here are 6 things to expect from the next year about ChatGPT. Number 1, AI tools will not be credited as authors of scientific publications. When ChatGPT was released in November 2022, the first studies started coming out weeks after that, and ChatGPT, at least in 3 studies, was listed as a co-author of the paper. There was a huge scientific debate, and finally, the major publishing groups like Springer came out with the announcement that ChatGPT and such AI tools cannot become co-authors of papers because these tools obviously cannot take responsibility for the content that these provide. So don't expect ChatGPT and AI in general to become co-authors of studies, but very much expect researchers around the world to use ChatGPT to write abstracts and parts of the text, but they will have to mention that very clearly and transparently in the acknowledgement section. Number 2, medical alternatives of ChatGPT will arrive. Just weeks after ChatGPT was released, Google announced, of course, its own ChatGPT-like tool, Bard, coming out. And Bard has a very similar chatbot that the Google engineers developed that was based on medical data and databases. It was called MedPalm. Even a study came out at the end of 2022 about that, detailing and describing all the things that matter about this medical alternative. Just imagine using ChatGPT for medical purposes. You can ask certain questions like help in administration, or write an email or a social media post for patients. But when it comes to a real medical chatbot that was trained on medical data and medical interactions, it's a different scenario. It means patients could turn to these chatbots to find and get reliable, valuable information. Physicians could use these chatbots to gather pieces of information from all the studies that they cannot check out physically because there are 32 million studies out there on PubMed.com, the major database of biomedical literature. So expect to see medically trained chatbots coming out soon. Number 3, doctors will see mayhem when patients come with the information they received from ChatGPT. For the last 2 decades, physicians have been complaining about patients arriving after Googling their symptoms online. But of course they do. Every empowered patient is active online. They want to obtain data and information to better understand how to contribute to their health or disease management. But in that case, they will come with data, information, pieces of advice they received from ChatGPT-like tools. It's a mayhem, so we will need some time to learn the tricks about dealing with patients coming with ChatGPT-derived information. We will have to see how physicians can manage the expectations of patients about the information they get from AI, and how to become the guides for those patients in the jungle of not just information, but even AI-based medical tools. Number 4, where are your sources and references, ChatGPT? It's very important that when you find medical information online, the best, most reliable medical websites indeed list the sources, the references they base their information on. When you do the same with ChatGPT, you find nothing. You get the response you need, which might be reliable or not, but you don't see what kind of references the information is based on. Now you can proactively ask for that, like you have a medical question, you get a response from ChatGPT, and then you can reply, please cite and list your resources you base your information on. And it will give you a list of resources. So we all have to level up our skills about being able to verify information, even if we can get the actual list of resources from ChatGPT. Number 5, using chatbots will become a part of every medical curriculum. I've been teaching medical students about AI, the dangers, the importance, the methods of artificial intelligence for many years. And now I also teach them about using ChatGPT, because it can indeed be the best assistant a physician can ever hope for, if they know how to use it, if they know how to verify information, how to get the required list of resources from ChatGPT, if they can write better and better briefs and prompts. There is one more issue related to that. Written assignments. I require students to write science fiction short stories about, for example, a medical technology going berserk 10 years from now, to make them think about the future, the ethical, social implications. Now I have to use other AI tools that compare the assignment they sent in to literature and the internet in general, and tell me what's the percentage, what's the chance that that assignment was written by AI or just humans. It's a very important piece of information, but it means for us educators, we have to come up with even more creative ways of making students fight for their good grades. Before moving to the next point, let me just mention that we published a course, Introduction to Artificial Intelligence in Medicine and Healthcare, at the Medical Futurist. It's a digital course that mentions everything that matters about AI. Definition, levels, methods, advantages, dangers, everything that's related to medicine and healthcare, even when it comes to tools like ChatGPT. And number 6, our final point, we will see a healthcare company implementing ChatGPT into its service. It would mean that I think a healthcare company, probably in the US, will start using ChatGPT as a part of their service, whether for scheduling appointments or writing marketing emails and social media posts, or being able to have a discussion through a chatbot with the patient before even having the first appointment. But ChatGPT will be the integrated part of a service of a healthcare company in 2023. So these are the 6 points, 6 trends I expect from ChatGPT. But in the meantime, we can do at least one thing. Please go to ChatGPT, start writing briefs or prompts, even just for fun reasons. But we all, working in healthcare, we all need to learn how to work with AI. And this breakthrough technology finally gives us an opportunity to do it in practice. If you like this video, please subscribe below to get notified about every single new video we come up with. And also please go to medicalfuturist.thinkific.com, where you will find our 2 courses, the Digital Health course and our newest one, Introduction to Artificial Intelligence in Medicine and Healthcare. See you there.